Hello, everyone. I am Julie Hallet, an associate professor of surgery and HPB surgical oncologist at the University of Toronto, and I am also the president-elect of the Society of Surgical Ergonomics.
And I'm Susan Hallbeck, a professor of healthcare systems engineering at the Mayo Clinic in Rochester. I'm a certified professional ergonomist and industrial engineer with a focus on human factors. I'm the past president of the Human Factors and Ergonomics Society and the current president of the Society of Surgical Ergonomics.
And today together, we have a fascinating topic to discuss. We'll be reviewing the evidence behind intraoperative microbreaks and their role in the operating room for ergonomics to improve OR staff discomfort and mental focus. Dr. Hallbeck and her team have pioneered key work in this field and launched an app that is there to facilitate intraoperative microbreak. Discomfort is sadly and somewhat unsurprisingly common for surgeons, and that is true for all surgical specialties. About 7 out of 10 surgeons will report experiencing musculoskeletal pain, and that is seen across all surgical specialties. This isn't just about personal discomfort. Pain, discomfort, and injury can reduce a surgeon's accuracy and performance, which, of course, can then impact patient safety. It also leads to changes in their practice over time, such as 22% missing work days, 35% reducing the number or volume of cases they're doing, and 12% taking leave of absence. Beyond the personal repercussions this entails, it also has consequences in terms of the sustainability of the surgical workforce and access to delivery of surgical care. So obviously, this is an important issue to address, but how do microbreaks factor in here? How did this idea of surgeons taking break in the operating room start?
So OSHA has talked about breaks in industrial settings and in settings for offices, taking short breaks throughout the day and alternating tasks. And so one of the things that we did is we also looked at the literature, and we found that Dorian and Darvaux had done this study in 2013, where they had 10 surgeons and 6 residents, and they did a crossover study with breaks every 20 minutes. And they assessed discomfort, fatigue, and accuracy by tracing a star pattern with a Metzenbaum. What they found is that fatigue was reduced, discomfort was reduced, and the accuracy of the star pattern was increased statistically significantly. Prior to Dorian and Darvaux, Engelman and his colleagues also did an intraoperative microbreak and looked at the mental and physical impacts of that. They were able to take 5-minute breaks every 30 minutes. And that one really startled our administrators, saying 5 minutes every 30 minutes, that's going to increase operative time, which started to be one of our metrics. They did find that they reduced stress hormones and reduced fatigue, and they did not increase OR time despite that 5 minutes every 30.
So this is great, and it would make sense that the science behind breaks in other fields would also apply to physically and mentally demanding environments like the operating room. So with those studies already in there, what did you feel was missing, or what else needed to be done to develop microbreaks for surgeons?
So we had those 2 studies that showed that microbreaks were important. What we didn't have is how they could be put into actual operating rooms. So when Dr. Adrian Park came to Mayo as a visiting professor, Dr. Bing Casey, and I came up with a study to test the effectiveness of microbreaks across not only Mayo and Anne Arundel Medical Center, but also included Carolinas Medical Center and the University of Louisville School of Medicine. And what we found was we needed to have some stretches or exercises that were scientifically based. They needed to be less than 90 seconds. They couldn't break scrub, and they targeted the main areas where surgeons had pain and discomfort: the neck, back, shoulders, hands, and lower extremities. What you're seeing in the background, for those of you who are on the web, is these exercises that we have slimmed down to be 60 seconds.
And so those can be done either standing, there's a set where you can be sitting as well, and you don't have to break scrub.
That's right. And people really find them to be relaxing And some of the residents have even said this gives them a short period of time to think about the next phase of the case. So they enjoy that as well.
How is this welcomed beyond residents by surgeons and other OR staff?
Well, as you know, any kind of change can be difficult to introduce into a new practice. Some were skeptical, some were worried about the time that it might add to surgeries. But once they experienced the benefits firsthand, many were convinced and they welcomed the intervention. They really even said things like, I used to crawl out of my OR and now I don't. I've gotten fist bumps from older surgeons who I would have predicted would never like this.
This is really wonderful, but do we have any evidence beyond those reports from individual surgeons that those micro breaks make a big difference?
We do. We did the study across the 4 sites where we found that the duration of surgery did not increase. The surgical difficulty was the same between the with and without micro breaks. And we found that the discomfort of major muscle groups versus baseline statistically significantly reduced. 62% of the people that we studied felt it improved their physical performance. 36% said it improved their mental focus. We also noted that the pain scores in the neck, the wrists, the back, the shoulder, and even in the lower limbs was reduced.
Wow, those are really some very encouraging results. And I believe you have further data after this that kind of validated those findings, in particular in a multi-institutional prospective study.
One of the things we found was that the pain score improved, especially for the neck, the right wrist and shoulder, the lower and upper back, and the left shoulder and wrist, as well as a little bit in the lower limb. We found that people really did feel better after using the micro breaks targeted stretching. One of the things that we found with the manual stretches was that 87% of the surgeons wanted to have this in their OR, but we couldn't all go in there and do the manual stretches with them. So we created a web app that's free and available to the public. So from that web app, we also have some data that is showing that most people find that their mental focus is better. About 8% say that it's worse. The physical performance they feel is better. About 5% say it's worse. The pain level is statistically significantly better. About 3% say it's worse. And the fatigue level is much, much better. And about 5% say it's worse. So we have reported improvement, again, in mental focus, physical performance, pain, and fatigue levels.
And so we are talking about this web app. I think your team has developed some tools to help surgeons integrate this into their practice. Can you maybe run us through these and how would you suggest surgeons integrate those tools into their clinical practice?
Sure. We have a set of quick reference guides and even this web app that reminds the surgical team to take a micro break and guides them through the stretches. So if you go through that, you'll put in your own email. There's a quick EU GDPR acceptance. Then you'll see the web app. And you can set the reminder interval anywhere between 30 minutes and 120 minutes. We suggest about 45. At the end of the time when the alarm would go off, it'll make a harp sound. And you can either snooze it at that point, or you can hit the go button and the stretches will start. And they're about 60 seconds in length. And they are based on neural flossing, and they will help you sustain yourself through your operations. When the stretches are done, it will take you back and start the timer again. If there's ever a time that you need to stop or pause, there's a way to do that as well. Or if you're waiting for pathology to come in the room or going to the core to get some new equipment, and you feel like it's a good time to stretch, hit the go button whenever you want to. And we do have the URL there. It is orstretch.mayoclinic.org. We also created some between surgery stretches that mimic some of the tasks that we had in the OR stretch that you can do surreptitiously in the surgeon's lounge. Nobody really needs to know that you're stretching, or especially in meetings. You can get away with some of these stretches as well.
And so we have a QR code here to be able to access the video for the between surgery stretches. And we're going to leave this in the notes for people who are listening on the podcast platform. That all is really incredibly useful. And I can say from my personal experience that this web app for micro breaks in the operating room is very easy to use and to integrate into practice. Actually, it's much appreciated by the entire team. I've realized now that if I don't set it up myself at the beginning of a case, because it happens that I forget, I will be reminded by someone from the operating team to set it up. It can be trainees, nurses, anesthesiologists, anesthesia assistants. People really want to participate in this stretch.
I'm incredibly grateful that your team really likes it. And they even sent me a video of them with a little soundtrack that went with it, which was very funny. One thing I'd say is that I'd encourage all surgeons to try integrating the intraoperative microbracing into their routines. The evidence suggests it would greatly benefit your well-being and your practice. And I want you to have the longest career that you want to have.